and welcome to our special show, Health and Wellness, Save a Life. I'm Gargi Rawat. The problem of sudden cardiac death is a major concern all over the world, affecting people of different age groups. When medical emergencies like cardiac arrest happen around a person, it's important to be prepared. If you are aware and informed, then you can take steps to revive a person and save his or her life. Worldwide, millions of people die of sudden cardiac arrest every year. Raising public awareness and understanding of the practical applications of CPR is an essential strategy to increase CPR success in cardiac arrest cases. It's even more important to learn about CPR if you have a loved one who has a history of cardiac disease, as research reports that the majority of cardiac arrests occur at home. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and be trained on giving CPR. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We're joined by Dr. Harish Bajaj, interventional cardiologist, Aradhya Cardiac Care, Mumbai, Dr. Sushil Yadav, interventional cardiologist, Chandan Hospital, Lucknow, and Dr. Vivek Raj Singh, consultant, interventional cardiology, director, Vardhan Hospitals, Varanasi. Thank you so much, doctors, for joining us on this program to create awareness on this very, very important issue. Now, Dr. Bajaj, let's start with you. And heart attack, cardiac arrest, and other cardiovascular diseases have remained a major health concern around the world, but recently there seems to be a rise in the number of cardiovascular problems among the younger population. Why is heart disease becoming more prevalent among young people?
See, in young people, the most common cause of death is a heart attack. And one of the reasons for this is either increased tobacco consumption or LDL cholesterol, blood pressure, or diabetes. Now, many times these risk factors are very silent, which are not been diagnosed. So this is like a car running very smooth with a good speed, good AC, good music, but the petrol is showing yellow. So we recommend in young people, sometimes they say everything happening because of the stress. I got a lot of stress, but they consume a lot of tobacco. Their BP is high, but they think it's because of stress. They don't take medicine, or the sugars are higher, or cholesterol is higher. So stress directly may not cause a cardiac arrest, but they have to control the risk factors. So we suggest a regular checkup for an LDL cholesterol, keep it as low as possible. Keep blood pressure below 130/80, sugars below 180. Don't take tobacco in any form. And diagnosing these things will really help preventing sudden cardiac death in the young people. Thank you.
All right. And Dr. Yadav, the early onset of substance use is associated with higher risk of developing many health complications. If you could explain to us, how does it affect cardiovascular health?
Yes. Good afternoon. Substance abuse or substance use in any form, either it is smoking, alcohol intake, marijuana, cocaine, it is just going to harm your body in one or the other way. The most common substance uses are smoking and alcohol in our country. Coming on to smoking, it causes various ill effects to your body like stroke, gangrene, especially in the younger population less than 40 years of age. Smoking is a major cause of heart attack in the younger age population, and persons even in their 30s or even 20s can suffer from heart attack because of smoking. It also causes various lung diseases, malignancy, carcinomas. Smoking basically it damages your cardiovascular system by increasing your blood pressure and heart rate instantly and also in the long term. It also causes damage to the inner lining of the blood vessels, which is known as endothelium, and because of that it predisposes oneself or the person to development of blood clots inside your body, which causes the heart attack, stroke, or gangrene. The chances of cardiovascular diseases, it is increased nearly 2 to 4 times in persons who smoke, and the chances of stroke, it is around 2 times increased in persons who are smoking. Coming on to alcohol intake, mild to moderate alcohol intake usually does not increases your health, it does not damage your health, but large intake of alcohol or binge drinking, it adversely affects your health in one or the other way. It causes higher blood pressure, higher fast heart rate, that is tachyarrhythmias. It can cause many arrhythmias. It causes heart failure, cardiomyopathies, and sometimes stroke. There is a belief that red wine is good for the health. Red wine, it has got some antioxidant as well as properties, as well as it increases the HDL or the good cholesterol inside your body. But this extra benefit of taking red wine, it can also be achieved if you walk or exercise per day and eat fruits. So if red wine, if it is taken in a large amount, it has got the same adverse effect like any other alcohol.
All right, Dr. Singh, so what are the pre-existing conditions that may increase the risk of heart failure and heart attack as well as cardiac arrest?
Yes, actually, in the last 2 decades, we have seen a surge of cardiovascular diseases in our country, and the reason behind is that the emergence of risk factor in the earlier age group in our community and the country. So we should not only should know the number of risk factors, but also to understand the risk factor, how they are dangerous to our health. So coming to the risk factor, the number one is the smoking and use of tobacco. Since this is very freely available and easily socially acceptable in our society, so use of tobacco is around 20 to 25% in our population. And the using tobacco not only causes the increased incidence or prevalence of the cardiovascular diseases, but it also causes a lot of different type of cancers in our body. Second most common cause is the hypertension, and the worry about the hypertension is 1/3 of population. They are having hypertension, they don't know about it, and even if they are knowing they are hypertensive, even with the they are not taking the proper medicine, and 10% of the hypertensive population they are controlled with the hypertension, controlled with the medicine. So 90% of the people with the hypertension, they are not very good control. So presence of hypertension and not controlling of the hypertension is hazardous for the cardiovascular disease and leading to the increased prevalence and incidence of the cardiovascular disease. Third one is the family history. If family history is present, first degree relative should be screened at least in their 30s for the cardiovascular disease or heart disease. First routine checkup should be done thoroughly. If any abnormality present during that one, it should be properly treated. The fourth one is the presence of diabetes. 10 to 20% of our population is affected by diabetes. Diabetes is not only a disease, but it's a syndrome. It causes cardiovascular disease as well as it harms other, it affects other body parts also. By nature, we live a sedentary lifestyle. So lack of physical activity, over stress, and all these things are the risk factor for development of the cardiovascular disease. So we should know, we should understand, we should try to keep away from these risk factors. If any of these risk factors is present, try to control your blood sugar and hypertension. If you are diagnosed case of coronary artery disease, it should be well controlled and maintained with the medications.
All right, Dr. Bajaj, are there symptoms or red flags that people should be on the lookout for that signal a young person is at a high risk of sudden cardiac death? And when should one consider going for screening? Right, Dr. Bajaj, if you can unmute yourself.
So in the young people, the most common symptom they have like an acidity, and they think is an acidity, but they miss it for the heart disease. So if a person has a risk factor, as mentioned before, high LDL cholesterol, diabetes, BP, tobacco, and even if they have an acidity, please get an ECG done within 1 hour. The sudden cardiac death is when they have symptoms, and within 24 hours, if their heart is arrested, so it's called sudden cardiac death. So if they have any symptoms, please go to the nearest hospital, get an ECG done. Especially when they have a severe heaviness in the chest, like someone has put more than 10-20 kilo, or they are fear to life. Or if this diabetic patient, he may not have typical symptoms, so they may feel breathlessness or uneasiness, which is new compared to before. So these are the patients who should immediately rush to the hospital. Don't do self-medication, taking sorbitate aspirin. Please show to the nearest hospital. That will be fine, and this thing will help. So these are the red flag sign. And people who have risk factors, kindly get a treadmill test done or 2D echo checkup done every 6 monthly, 1 yearly, so the sudden cardiac death can be prevented. Thank you.
All right, Dr. Yadav, as we there's a lot of information about self-care that can be taken during a heart attack. Can a person really help himself during a heart attack?
Yeah, definitely. See, first of all, everyone should be aware about two things. First of all, who can develop the heart attack? I mean, who are the persons on high risk for developing heart attack? And second, what are the symptoms of heart attack? So persons who are on the high risk of heart attack, they are chronic smokers, with persons with long-standing hypertension or diabetes, person with the prior history of any heart attack or stroke, any angioplasty done in the previously, or persons with history of angina who are on medical treatment. These are the persons who can develop heart attack. If they develop symptoms like chest pain, chest heaviness, or burning over the chest, sometimes which is confused with gastritis or gas problems, if associated with diaphoresis, that is excessive sweating, if there is a neck pain and sudden breathlessness. So these are the symptoms of heart attack. If anyone develops these symptoms, he should or she should immediately call for help, call for an ambulance. If you can reach the hospital within 30 minutes or within 1 hour, then don't take any self-treatment. Self-treatment and resisting these symptoms, resisting this pain that it will subside on its own, it should not be done. You should immediately go to a hospital, to a cardiologist. And if you are at a distance, you can't reach the hospital immediately, then Disprin can be taken. It should be chewed, 325 milligram of Disprin. And if the blood pressure is normal, sublingual nitrate, which is called sorbitrate, it can be taken. Immediately, the person should go to a hospital or a cardiologist where ECG, echo or any other blood investigation will be done, and the further course of management, the further course of treatment will be decided depending upon these investigations.
All right, so that's what a person who may be experiencing, a heart attack or cardiac arrest must do. But what steps should a bystander follow if he or she recognizes that someone is having a cardiac arrest? Dr. Singh, if you could answer that.
Yeah, bystanders, they are basically the non-healthcare professionals. They are given training about the cardiopulmonary resuscitation, and sometimes they are given certificate for the same. They are chosen from the places where the day-to-day basis the crowding used to happen, like the bus station, railway station, or in the schools, or in the airport personnel. So they are given formal training for the cardiopulmonary resuscitation. Once they get any person who is having cardiac arrest, at that point they should shout for the help for the other people also, and they should start the CPR as early as possible, because the outcome depends on the timing of the onset of CPR. When you start the CPR earlier, you will get some result, but if the CPR is started after a few seconds or few minutes, the result will be very worse. And at the same time, they should call the ambulance. The 108 number is in our country. They should call the ambulance or any other nearby well-equipped hospital for the help. Or while continuing the CPR, they should shift to the hospital for the definitive treatment for that patient. You can save at least 10 to 15% of the patients by these measures. So, role of bystander is very much in this situation.
All right, well, we have a lot more questions for the doctors, but we'll slip into a short break and return with more. Stay tuned. Welcome back. You're watching Health and Wellness. We're talking about the importance of awareness about cardiac health, as well as knowing how to perform CPR, and you could save a life. Let's go back to our doctors for more information. And Dr. Bajaj, cardiopulmonary resuscitation, known as CPR, is a life-saving technique. What exactly happens during CPR?
Yeah. So the cardiopulmonary resuscitation is a mechanism where you want to increase the blood flow or maintain a blood flow to the brain and other organs of the body. It's a rule of 2, 3, 5. If brain doesn't get a blood flow for 2 minutes, oxygen for 3 minutes, glucose for 5 minutes, it can cause a sudden or permanent brain damage. So the main aim in CPR is to have a continuous cardiac pumping, which is being done by a person who is a helper. So for example, on a mannequin, if there's a central part, there's a sternum. So lower part of the sternum, if you put one hand or the both hand and you compress it for around 2 inches every time and let it come up, and continuously you do it 50 times, 100 times. And laterally, there's a diaphragm in the lateral part of the chest, and you can do a sidewise compression also. So one recommendation is you can do with the both hand, like in the center part of the chest, you press it for continuously 5 times, and laterally you compress it for 1 time. So you have a pulmonary and the heart done. And this continuously should be done until the patient reaches to the hospital. So you call for a help, they go into the ambulance, and they can reach. So this cardiac pulmonary resuscitation should be trained to almost every individual, starting from the school days. And there are nice YouTube videos where they can also show. And this CPR is very essential to save the initial part of the treatment. Thank you.
All right, Dr. Yadav, is CPR different from women, or is it similar to CPR for men? And what happens if someone performs CPR in the wrong way? Is that also a possibility?
Yes. See, cardiac arrest, it occurs in both male and as well as female. But it is seen that the females are 25% is less likely to get the standard CPR because of the hesitancy to perform CPR over a female publicly. What should be known that cardiac arrest, it is an emergency situation, it is a life-threatening situation, and if CPR is not performed, then the chances of survival of that person or that patient, it decreases. With every single minute delay in CPR from the cardiac arrest, the chances of survival, it decreases by 10%. With every single minute of delay, 10% chance of survival will be decreased. With keeping the full modesty of the female, preserving the modesty of the female, one should try to do the CPR and try to save the female. There is no any such difference between performing CPR over male or female, as already told by Dr. Bajaj. We should put our both hands over the lower part of the chest, over the sternum. Then chest compression should be done at the rate of 100 to 120 per minute with rescue breath after every 30 chest compressions. The compression should be of at least 5 to 7 centimeter, not less, not more than that. And the rescue breath should be given after every 30 compressions. The second question, what happens if somebody does a wrong CPR? Basically, CPR causes pumping of the blood from your heart to the to all the vital organs of your body, the brain, the heart, and the kidney. If a wrong CPR is being done, which usually occurs because of the wrong technique. Wrong technique means you are not putting your hand over the sternum, over the chest. You are moving the hand while doing CPR. The rate is either very slow or very fast. The compressions are either very shallow or very deep. All these or the rescue breath, it is given in a wrong manner. These things may cause a wrong CPR, and it will cause decreased blood flow to the vital organs of the body and damage to them because of faulty CPR. The thing should be remembered that even a bad CPR, it is at least much better than doing no CPR. And by the cardiac arrest, it is reversible in few people if it is timely done within few minutes of the arrest. So one should try to save the person by doing CPR.
All right, Dr. Singh, a heart attack or sudden cardiac arrest is more likely to occur in people with existing heart problems or diabetes. What information should they carry with them while going out?
Yeah, while going out, 1 week before leaving your native place, you should consult your treating physician before leaving, so that drugs should be optimized. If you are feeling any kind of problem, you should share with your physician and get the permission, and then only go for outing. So you should carry all medicines in the proper amount while going out, and you should keep all your records at least a soft copy in your mobile while carrying. It will help the further treatment if you are feeling any heart problem outside your city. You should also know the symptoms of heart attack or heart failure. Like if you are feeling any exertional breathlessness, or you are feeling any palpitation, ghabrahat, fatigue, or giddiness during any exertional activity, it's a symptom of heart failure or heart attack. You should take a local visit to the nearby hospital and get at least first aid or the definitive therapy if it is a heart attack, and then only come back from that place.
All right. Dr. Bajaj, should a person with heart disease focus on lowering his or her dietary cholesterol or saturated fat to prevent the risk of heart disease? And how much cholesterol in the diet is allowed, and in what form is it best?
See, one of the main risk factors for heart attack, stroke, or blockages anywhere is the LDL cholesterol. So we should keep LDL cholesterol as low as possible. At the younger age, it's only 30 milligram. As the age advances, it goes higher. Now, the values of LDL cholesterol depends on what associated risk factor patient has. A young person without any other risk factor, LDL up to 130, 160 should be okay. But if they have a blood pressure or a tobacco, please keep it below 130 or below 100. Anyone who has a diabetes, keep it below 100. Or got a heart attack or stroke, keep it try to below 70 milligram per deciliter. So lower the LDL is better. Regarding diet, they should go for a lot of fruits and vegetables. The oil should not be seen in the gravy. Like young people, we say no hurry, no worry, no curry. So this is very important. So they should avoid red meat or high fatty food, dairy products, bakery foods or junk food. And this will reduce LDL cholesterol. They should try to climb equivalent to 30 floors per day, or at least 150 minutes per week. They should walk, do a lot of exercises. This will also increase the HDL cholesterol, which is protective for the body. And on long term, this lifestyle changes will increase the longevity. Because in India, life survival is around 70 years, but abroad is more than 80 years. So we still have almost 10 years lesser life expectancy compared to the developed countries. So as a media and a doctors, it is our responsibility to create more awareness for this. Thank you.
All right. And Dr. Yadav, finally, if the body weight is in control, does it mean a person's blood lipid levels would be normal and he and she cannot get heart disease?
See, being overweight or being obese, it usually means that you are having a higher amount of fat in your body and higher amount of cholesterol and lipids flowing in your blood vessels. But this is not always true. If you are obese and having a higher amount of cholesterol, it means the HDL and having a low HDL and high LDL, it usually causes atherosclerosis. This fat, extra fat, goes and deposits inside your arteries of your brain, of your heart, and causes atherosclerosis, and which can further lead to heart attack or a stroke in your future life. The total cholesterol, if it is less than 200, it is usually on the safer side. If it is more than 300, the chances of getting cardiovascular disease rises by 2 times. The HDL cholesterol, it should be more than 40. LDL, it should be less than 100. And sometimes less than 70 if the person is having other risk factor or he has history of heart attack. The triglyceride, it should be less than 150 milligram per deciliter. By doing exercise and by getting yourself more active, the cholesterol and the other lipids, it will be optimized. It can be optimized to the optimal level. There are certain hereditary disorders of hereditary lipid disorders in which the person might be of average weight or of thin weight, of low weight, but still he or she can have the lipid disorders and can have the cardiovascular diseases like combined familial hyperlipidemia, familial hypercholesterolemia, persons with chronic kidney disease, persons on certain drugs like steroids, person with HIV, person with type 1 diabetes mellitus. These are the persons who, despite having a lower or optimal weight, can develop cardiovascular diseases.
All right. Well, thank you so much, doctors, for joining us on the program and answering all our questions and creating awareness about CPR and heart disease. Thank you all for watching at home. Goodbye.